Chest muscles means what? Attached to the bones of the skeleton of chest. The skeleton of chest is formed by which bones? Ribs, sternum, thoracic vertebrae.
Yes.
But muscles of the chest divides into two main groups. First group of muscle includes the muscles which move the shoulder, and because by one end that muscle is attached to the bones of the shoulder, that will be clavicle, scapula or humerus. And the second group of muscles of chest called so muscles of respiration, respiratory muscles, which are important during the respiration. During the the respiration has two stages: inspiration, expiration, inflow, outflow. Yes. During the inspiration, thoracic cage increases in sizes. Increase in size possible by the elevation of ribs. During the expiration, the thoracic cage decreases in diameter, in size. So how? Ribs depresses, or muscle, the second group of muscles of chest or muscles of respiration elevates the ribs or depresses the ribs. The function of that muscles is this. Yes? First group muscles, all muscles which attach to the shoulder, are the first muscle which is visible under the skin, superficially located, pectoralis major muscle. This is pectoralis major. Or, look, the muscular fibers, sum of fibers originates from which bone? Clavicle. Other fibers originates from which bone? Sternum. Lower fibers originates from aponeurosis of the abdominal muscles. Later about this.
From the diaphragm?
Attach, what?
Diaphragm?
No, not from the diaphragm. Diaphragm separately. Yes, and third, separately we have muscle or muscle, which is important during the respiration, diaphragm. But the pectoralis major don't originate from the diaphragm. The pectoralis major muscle inserts to the humerus. If you cut pectoralis major muscle, under the located pectoralis minor muscle. This is pectoralis minor muscle. Originates from which bones? What are these? It is not second. It is third, fourth and fifth ribs. Inserts to the scapula, acromion of the scapula. Next muscle is subclavius muscle. This is subclavius, which is located between clavicle, originates from lateral end, acromial end of the clavicle, inserts to the cartilage of the first rib, or it located between clavicle and first rib. And the last muscle is serratus anterior muscle. This is large, broad muscle, originates from upper external surface of upper about 10 ribs, covers totally the lateral external surfaces of these ribs, passes back and inserts to the medial border of the scapula. Function of these muscles. Pectoralis major muscle attached to the shoulder. Yes, it performs movement of shoulder toward the sternum or in front. Other muscles also move shoulder or scapula. For example, serratus anterior muscle also moves scapula laterally or front. Together, these two muscles moves in front, the scapula. But some of them, that's serratus anterior. Water. Serratus anterior and pectoralis minor muscles attached to the ribs or originates from ribs. That means they helps in respiration, during the respiration. They are not primary respiratory muscles, but they help for other muscles during the respiration. Second group of muscles, or muscles of respiration, are these muscles which are located where? Between ribs. Yes? Connects two ribs with together. This called external intercostal muscles because they visible on the external side. External intercostal muscles totally how I can tell
Look like a cycle.
starts
Between the
yes, totally connects two ribs with together from front to the posterior end of the ribs.
Covers all the rib, you mean?
They don't cover the ribs, but they originate
This-
from lower border of the upper rib. Listen how I explain. And inserts to the upper border of the lower rib. That means contraction of these muscles elevates the ribs, or external intercostal muscles functionally are muscles of inspiration. Understand? Second muscles, which are located also between ribs, connects the ribs with together, called internal intercostal muscles. But they could visible on the inner side of the chest, from internal side of chest. These are internal intercostal muscles. Internal intercostal muscles originates opposite from upper border of the lower rib and inserts to the lower border of the upper rib. Contraction depresses the ribs. All these are muscles of expiration. Next, also from the inner side of chest, visible subcostal muscles. These are on back side of the chest, near to the vertebral column they are located. Origination, insertion, same with internal intercostals, or originates from upper border of lower rib, inserts to the lower border of upper rib, but not directly to next rib. Passes through one rib or through two ribs. Understand? And these are also expiratory muscles. And last, transverse thoracic muscles. These muscles, which are located also visible on the internal side, from inner side of the chest, but on the anterior wall, behind of the sternum. Originates from the lateral borders of sternum and inserts to the ribs, from down upward.
This is called what?
Also expiratory muscles, transverse thoracic. Or only external intercostal muscles are primary inspiratory muscles. All others, internal intercostal, transverse thoracic, and subcostal muscles are primary expiratory muscles. But we have one large big muscle in body for inspiration, that is diaphragm. Where is located the diaphragm? This is diaphragm. This is the superior view of the diaphragm from thoracic cavity, visible this surface. This is inferior surface or inferior view of the diaphragm from abdominal cavity.
احنا نسميها الحجاب الحاجز بالعربي.
حجاب الحاجز. خلاص
Yes,
حفظنا حجاب الحاجز.
for the abdominal chest.
Look here.
Yes.
Diaphragm.
يا سلام.
This muscle which is located here. So totally closes the inferior aperture of the thorax. By the diaphragm thoracic cavity is separated
Abdomen.
from abdominal cavity. Understand? Like roof of this classroom. Understand? The muscular fibers or the diaphragm forms the floor of the thoracic cavity and the roof of the abdominal cavity. Understand? The muscular fibers, look at that picture, it originates from all parts of the inferior thoracic aperture. How is formed inferior thoracic aperture? By the 12th thoracic vertebra, 12th rib, 11th rib, costal cartilage, and xiphoid process. Yes? Some fibers originate from 12th vertebra, other fibers from 12th rib, 11th rib, costal arch and xiphoid process. These fibers from these bones passes upward. It is dome-shaped structure, but in the middle, the muscular fibers connect with together by the tendinous part. What is that white color? Tendon. Yes? Which called tendinous center of the diaphragm, or central part of the diaphragm. This tendon, not muscle. But if it totally separates thoracic cavity with abdominal cavity, how some structures, blood vessels or some organs passes from thorax to the abdomen or in opposite direction. For that large organs or structures, the diaphragm has holes, orifices. Totally, the diaphragm has three hiatuses: esophageal hiatus, aortic hiatus, and hiatus for vena cava inferior. Esophagus is organ of digestive system which starts on the neck region and connects tube up to down, connects with stomach, which we have in abdominal cavity. Yes, it passes through the diaphragm by the esophageal hiatus of the diaphragm. Aorta is largest vessel of the body. Aorta, which starts from the heart, which we have in thoracic cavity. Aorta is also large tube. From thorax passes down, enters abdominal cavity, gives many branches, many other arteries for blood supply of all parts of the body. Some of them located in chest, some of them in abdominal cavity or lower limbs. It passes through the diaphragm, through the hiatus aorticus of the diaphragm. And vena cava inferior. Totally we have two largest veins, vena cava superior, vena cava inferior. Superior collects the oxygenated blood from upper part of the body, above of diaphragm. Upper limbs, chest, head, neck region, drains into the heart, which is in thoracic cavity. But vena cava inferior collects the oxygenated blood from lower limbs, abdominal cavity, pelvic cavity. It also drains into the heart, which we have in thorax. Understand? It starts in abdominal cavity, passes upward through the hiatus vena cava inferior of the diaphragm, enters thorax and drains into the heart. But except these fractures, we have many other blood vessels, arteries, veins, nerves, lymphatic ducts, which passes from up to down or in opposite direction. But they are not so large in diameter. They are narrow tubes which can pass it through between muscular fibers of the diaphragm. Understand? Don't think that only these three structures connects thoracic cavity with abdominal. No. Finish is the muscles of chest. Back muscles. This is the back region, yes? Skin visible. Firstly, the back muscles of back divides into two main groups, superficial muscles and deep muscles. Superficial muscles of back are under the skin visible two muscles generally, this and this. trapezius muscle, which is located on upper part of the back, and latissimus dorsi muscle. Mostly it is located in lower part of the back. Trapezius muscle. Remember, muscles are paired. Right, left, you know, yes? Trapezius called two muscles together. This is one, this is another. Each muscle has shape like trigon, but both muscles have shape like trapezius, and because it's called trapezius muscle. Look, this line is line of origination of the trapezius muscle. Tell me, from where originates? Occipital bone. What? Occipital. Which occipital bone has two eminences? External. Next, these fibers originates what we have here. Which parts of the vertebra?
Processes, spinous process.
Spinous processes of all cervical vertebrae. These fibers, what we have here?
Transverse processes.
Why transverse? Spinous processes of thoracic vertebra. Yes? Some fibers passes from up to down, some fibers from down upward. All of them inserts to what? What is visible here? Firstly, which bone we have here? Scapula. What is this? Which part of the scapula? Body. Acronym is not so long.
الرب بتاع بتاعتها نفسها ما هي
Look
كلاب
at the scapula.
كلاب كلاب لا
I think I should buy.
The scapular spine. Latissimus dorsi muscle also originates from spinous processes of from where it starts. This is the upper cortex. That means from here, yes, or spinous processes of lower six thoracic, spinous processes of all lumbar, and what is here? Sacrum. Which part of the sacrum? Not medial, median, in the middle. Median crest of the sacrum. Yes? From sacral iliac crest also some fibers. Passes upward. And how they passes, look here, passes under the shoulder and inserts to the humerus, but not directly from here to here. No, it passes so, surrounds the shoulder and inserts to the humerus. The contraction of this muscle performs this movement of the upper limb, look here, this, and toward the very good photos. Next, other muscles of back. These are also superficial muscles, but located under the trapezius muscle. Or if you cut trapezius muscle, you can see rhomboideus minor and rhomboideus major muscles. This is major, this is minor. Upper small, lower big. Yes? This minor muscle originates from spinous processes of last two cervical vertebrae. Major originates from spinous processes of upper four thoracic vertebrae. Both inserts to what? Is this? Which bone?
The border of the
Border. Which border? Medial border of the scapula.
scapula.
Next muscle, levatoscapular muscle. Elevates the scapula. Originates from, these are lateral sides. What we have laterally here? Which bones?
This is the neck.
Neck, yes, of course. Cervical vertebrae. Yes, but laterally what have cervical vertebrae? Transverse processes of cervical vertebrae passes down and inserts to the superior angle of the scapula. Next, if you cut rhomboid muscles, third layer, on upper part of the back, not totally, on the upper part. We don't cut latissimus dorsi, yes? Third layer is formed by muscle, which called serratus posterior superior muscle. Originates from spinous processes of last two cervical and spinous processes of upper two thoracic vertebrae, inserts to the ribs. First upper four ribs. Yes? And last, superficial muscle, which is located on the lower part of the back, under the latissimus dorsi muscle, is, how will be the name of this muscle? What do you think?
The inferior.
Oh, yes.
Is in the
This is serratus posterior superior. This will be serratus posterior inferior muscle. Deep finishes the superficial muscles. Deep muscles of the back. There are many small little muscles which located between spinous processes, semispinalis, semitransversalis, so-called these small muscles, but you can remember only this large muscle, which is located between spinous processes of vertebrae and costal angles in this space portion of the back, called erector spinalis muscle, but this erector spinalis muscle is formed by three separated muscles. The medial, which originates and inserts to the spinous processes of thoracic vertebrae, called spinalis thoracis muscle. This in the middle located muscle, which called longissimus thoracis muscle, and lateral one called iliocostalis thoracis muscle. That's all. Muscles of back. The walls of abdomen mostly is formed by the muscles, or abdominal cavity, where present are, we have abdominal cavity under the diaphragm, below the diaphragm, before terminal line of the pelvis. You remember, Sina? Show the terminal line. Now, firstly, you can move this. Yes or not? Next, diaphragm is located here. This is terminal line. When I'm explaining you pelvis, I'm explaining terminal line also, which divides greater pelvis with lesser pelvis or true pelvis. Or abdominal cavity, called this portion. Cavity between diaphragm and terminal line. Below the terminal line, we have pelvinar cavity, where are located pelvinar organs. These are abdominal organs, these are pelvinar organs. Abdomen has how many walls? Superior, which is formed by the diaphragm. Posterior wall, which is formed by the muscles, located here. Lateral walls also are formed by the muscles, which has this direction, located here. And anterior wall also. Understand? Posterior wall of the abdominal cavity is formed by quadratus lumborum muscle. This is quadratus lumborum muscle. Why it's called so? It has shape like quadrate shape. Originates from 12th rib, look there, and passes down, inserts to the iliac crest. Yes? Lateral paired quadratus lumborum muscles, and maybe in your books there are other muscles of posterior abdominal wall also, which called psoas major and psoas minor muscles. By other classification, psoas major and minor muscles are muscles of pelvis, but both correct. Lateral abdominal muscles. This is lateral side of the abdomen. Yes? Or this. Under the skin. The first flat muscle, which is located. This is external oblique abdominis muscle. Why it's called so? Look at the direction of fibers. Oblique direction. Yes? From up to down, from back to front. Understand? The muscular fibers of external or oblique abdominis muscle originate from lower 5 or 6 ribs, upper portion, other from latissimus dorsi muscle or from iliac crest also, passes front and anteriorly continues into the aponeuros of external oblique abdominis muscle, that is this white color. Look here, this is aponeuros of external oblique abdominis muscle, visible here. We have two external oblique abdominis muscles, yes? Both anteriorly continues into the aponeurosis, yes? And the aponeurosis of right and left oblique abdominis muscles in the middle of the anterior abdominal wall between xiphoid process and pubic symphysis in this, along of this line, fuses, connects with together. This line. Understand? Next, if you cut external oblique abdominis muscle under this muscle, located the second muscle, which called internal oblique abdominis muscle. Internal. Muscular fibers also has oblique direction, but from down upward. Understand? Or if external oblique abdominis muscle fibers has this direction, internal oblique abdominis muscle fibers has this direction. They cross. Understand? Internal oblique abdominis muscle anteriorly also continues into the aponeuros. This is white. And the aponeuros of right internal oblique abdominis muscle fuses with aponeuros of left internal oblique abdominis muscle in the middle of the anterior abdominal wall. Understand? Last, third muscle, located under the third layer, under the internal oblique abdominis muscle, and called transverse abdominis muscle. This fibers have transverse direction. Anteriorly, this muscle also continues into the aponeuros, which fuses with together in the middle of the anterior abdominal wall. Why I say so much about this connection of aponeurosis? On the anterior abdominal wall, in the middle, on the skin, also visible the vertical line, which has special name, linea alba, white line, alba means white, which is formed by the connection of aponeurosis of lateral abdominal muscles, or external oblique, internal oblique, and transverse abdominis muscles. In the middle of little lower, we have umbilicus also. Linea alba, umbilicus, and on the lower part of the anterior abdominal wall we have inguinal canal. Also, these three parts of the anterior abdominal wall are parts on the wall where can develop hernias. What means hernia, you know?
No.
The walls of abdomen is formed by muscles. We have not bones which can protect the organs which we have in abdominal cavity. Yes? Why the lateral abdominal muscles has so direction which crosses fibers together? Because they protect, they forms hard lateral and anterior wall also of the abdomen. Understand? But somewhere the wall is not so hard. Along of linea alba, which is formed by the fusion of aponeurosis, umbilicus, which is this small point, is formed only by skin behind, inside, maybe little fat tissue and fascias, and that's all. But sometimes increases pressure in abdominal cavity. When increases that pressure in abdominal cavity? When you take heavy subjects, for example.
Okay.
When the child, newborn, crawlings, fasten or how?
Yeah. The child always cries.
Always
Yes.
cries, increases the inside abdominal pressure. During the increase of abdominal pressure, the small intestine, which is located,
طفرات السرتين قول يمكن.
سرة
We call it surra in Arabic, so just reminding my friends of it. That's all.
when increases blood pressure in abdominal, not blood pressure, pressure of abdominal cavity. The small intestine we have in abdominal cavity, yes? That small intestine presses the wall of the abdomen, comes near to wall, it presses, and if you have soft part, the small intestine protrudes between, protrudes under the skin, passes between these aponeurotical fibers where they connect with together.
Yeah, I think I know.
Understand?
Yeah.
Or in umbilical, under the skin of umbilicus, for example. And this causes the pain. Understand?
Yeah, that's the disease that happens when we lift very high weights.
Yes, in old people sometimes develop hernias also because of during the age the muscles losses their straight engagement or how I can they become more soft. And mostly the hernias develops in old people or in childs or if you take every time heavy subjects.
You get used to it.
But I don't explain you anterior wall of the abdomen. Yes? Anterior wall is formed mostly by one large muscle, is one pair, which called